What if the reason your teeth aren't as white as they used to be has nothing to do with aging and everything to do with what's sitting on them right now? What if you could brighten your smile at home, safely, using 2 inexpensive ingredients that cost less than a cup of coffee? No expensive dental procedure, no harsh whitening strips, no painful sensitivity. Today, I'm going to show you exactly how to whiten your teeth naturally using just 2 simple ingredients. And then we're going to go deeper. We'll talk about oil pulling, gum health, sugar, vitamin C, and something called leaky gums that most people have never even heard of, but absolutely need to understand. Because whitening your teeth isn't just cosmetic, it's connected to your overall health. Let's start with the simple part. Before we mix anything together, it's important to understand what we're actually trying to fix. Teeth become stained for a few main reasons. Coffee, tea, red wine, smoking, aging, plaque buildup. All of these introduce pigmented compounds, called chromogens, that bind to the outer layer of your teeth. Your enamel may look smooth, but under a microscope it has microscopic pores. Pigments settle into those tiny grooves and bond there over time. That's why brushing alone doesn't always remove discoloration. Stains are essentially pigmented molecules that bind to the surface of enamel. To remove them safely, you need 2 things working together. A gentle polishing agent to lift surface buildup, and a mild oxidizing agent to chemically break apart stain molecules. When these 2 mechanisms work together, you don't just scrub stains, you dissolve their chemical bonds. Baking soda is inexpensive, widely available, and extremely effective when used correctly. Chemically known as sodium bicarbonate, it has a slightly alkaline pH. That alkalinity helps neutralize acids in the mouth, which is important because acidic environments weaken enamel and allow stains to set more deeply. It provides a mild abrasive texture, not harsh, not damaging, that helps polish surface stains and break up plaque. The key word here is gentle. Unlike some commercial whitening toothpastes that contain aggressive abrasives, baking soda is considered low on the relative dentin abrasivity scale when used properly and not overused. It smooths the enamel surface, which can actually make teeth reflect light better, instantly giving a brighter appearance even before deeper stains fade. This is critical. You must use 3% hydrogen peroxide or less, not 15%, not 40%. Higher concentrations are what dentists sometimes use in-office with LED or UV activation. Yes, they work quickly, but they can also irritate gums, dehydrate enamel, cause temporary tooth sensitivity, create sharp nerve discomfort, increase enamel porosity when overused. Hydrogen peroxide works by releasing oxygen molecules. Those oxygen molecules penetrate stain compounds and break their double bonds, which essentially bleaches the pigment without grinding down enamel. The active ingredient in most whitening strips? Hydrogen peroxide. You're just paying a premium for branding, plastic trays, and marketing. When used at 3%, you get the same mechanism, just slower and safer. Here's how you prepare it, and why each step matters. 1 teaspoon baking soda. 3 drops of 3% hydrogen peroxide. 8 drops of water. Mix into a smooth paste. It should be slightly creamy, not runny, not dry. The water helps buffer the mixture so it's gentle on enamel while still effective. When combined, the hydrogen peroxide begins releasing oxygen molecules. These oxygen molecules penetrate microscopic enamel pores and break apart the double bonds of stain pigments. At the same time, the baking soda acts as a polishing agent, not grinding your enamel down, but helping lift loosened pigments and plaque from the surface. Repeat this 2 to 3 times per week for several weeks. Apply the mixture with a soft bristled toothbrush. Gently brush the outer, inner, and chewing surfaces for 1 to 2 minutes. Use light pressure. Imagine polishing glass, not scrubbing tile. Do not scrub aggressively. Excess pressure can irritate gum tissue and gradually thin enamel over time. Pay attention to stain-prone areas, especially near the gum line and between teeth, but always stay gentle. After brushing, rinse thoroughly with water. You may notice a slightly cleaner, smoother feeling immediately. Because this is a lower concentration approach, whitening happens gradually, but safely. Gradual whitening protects your enamel's integrity and prevents sensitivity. If you ever notice irritation, reduce frequency. Whitening should never feel painful. Now let's go deeper. Biofilm-forming organisms involved in plaque. At first, it sounds unusual. Swishing oil in your mouth for 10 to 20 minutes. But this practice dates back thousands of years in traditional medicine systems. Traditionally, sesame oil was used. Today, coconut oil is popular because of its taste, texture, and antimicrobial profile. Coconut oil contains lauric acid, a medium-chain fatty acid with well-documented antimicrobial properties. Lauric acid is antimicrobial against harmful oral bacteria. Here's what makes oil pulling interesting. Many oral bacteria are lipid-coated. Oil has an affinity for lipids. When you swish oil for 10 to 20 minutes, 3 things happen. Mechanical agitation disrupts plaque colonies. Oil binds to fat-soluble bacterial membranes. The viscosity helps pull microbes away from gum pockets and crevices. Over time, this may reduce bacterial load and inflammation in the gums. Some studies suggest oil pulling may reduce gingivitis and plaque levels comparably to certain mouthwashes, without the alcohol content that can dry oral tissues. It's not a replacement for brushing and flossing, but it can be a powerful adjunct strategy for improving overall oral ecology. Here's how it works. When you swish oil around your mouth, the oil binds to lipid-coated bacteria and biofilm. Over 10 to 20 minutes, the mechanical swishing combined with the oil's fat-soluble properties helps disrupt bacterial colonies. Then you spit it out, removing microbes with it. Most people do this 2 to 3 times per week. Always spit it in the trash, not the sink. Now here's where things get even more interesting. Have you ever noticed your gums bleeding when you floss? Most people assume it's just aggressive brushing, but often it's biochemical. Vitamin C is essential for collagen production. Collagen is what holds your gums tight and firm around your teeth. Without enough vitamin C, gum tissue weakens. That's what caused scurvy historically. Bleeding gums, loose teeth, poor healing. But here's the twist. Glucose competes with vitamin C for cellular entry. They have similar molecular structures. When blood sugar is consistently high, vitamin C uptake into tissues can be reduced. So even if you consume vitamin C, high sugar intake may block its optimal function. That means weaker gum tissue, increased inflammation, greater bleeding, higher infection risk. Sugar doesn't just stain teeth. It weakens the supporting structure. Now let's talk about something most people never consider. Your gums are a barrier. If they become inflamed or compromised, tiny openings can form between tissue and tooth. That creates a pathway. Bacteria can enter the bloodstream. This isn't speculation. Researchers have identified oral bacteria in arterial plaque, heart tissue, even brain tissue in certain neurodegenerative conditions. Oral health is systemic health. Inflamed gums are not isolated. They are an open door. Don't overuse harsh whitening systems, but strengthening your gums, that's protection. Practical strategy for healthy white teeth. Use the baking soda plus peroxide mix 2 to 3 times per week. Oil pull 2 to 3 times per week. Reduce sugar intake. Increase vitamin C from whole foods. Stay hydrated. Brush gently, not aggressively. With that said, thanks for watching, and until next time. Bright teeth with inflamed gums is not a win. Healthy gums create the foundation for a naturally brighter smile. So start simple. Be consistent. Watch your gums. Watch your diet. And give your body the nutrients it needs to support collagen and tissue strength. Because your mouth is not separate from your body.